Headlines from the news and media. Environmental changes are fueling human, animal, and plant diseases, study finds.
Experts advise hunters to take caution as wildlife disease spreads.
Humans may be passing COVID-19 to common wildlife species.
Avian flu outbreak highlights need for improved wildlife disease tracking.
Welcome to The Wandering Naturalist, a Three Rivers Park District podcast. I'm Angela, she, her, a wildlife biologist with Three Rivers Park District.
And I'm Brandon, he, him, an interpretive naturalist with Three Rivers Park District. Three Rivers Park District manages over 27,000 acres of parks on lands that are the ancestral and contemporary homeland of the Dakota people in suburban Hennepin County and surrounding areas.
So join us as we wander from park to park and discuss your stories of the past, the nature in our present, and how they have shaped our parks.
Come wander with us,
The Wandering Naturalist. So we did a little bit of teasers here in the intro to, again, we should have had our better broadcasting voice, but hopefully you're getting that. I was struggling on what to do for a teaser for this one, so I was just like, let's go to the news, because this topic is something that I feel like we are so informed from the media and the news outlets of hearing this, buzzword of diseases. And we did go through a pandemic. We're still in a pandemic. That's terrible. That is very terrible. But just to tee it up, disease is defined as any change in the normal function or structure of any part, organ, or system of a living body. Diseases often demonstrate symptoms or signs, but it may be unclear how disease-causing agents are introduced and transmitted. But again, it's often a buzz topic in the news, generating dramatic headlines such as we shared in the teaser, because yes, we are learning more this month around diseases, specifically within wildlife. And I thought the title, Whispers of Wildlife Diseases, was appropriate because, again, like those headlines indicate, there's a lot of alarming news, research, media coverage, and everyone giving an opinion. Everyone's an expert, right? On everything these days. So how can you know what is real and what is indeed just whispers? And how much of this information do we really know or is unknown? So understanding how and why these diseases exist and what we should be worried about seems very mysterious and unknown. Or is it?
Yeah, I'm really intrigued by it because I think when we think about wildlife diseases, we often think about the ones that impact us, chronic wasting disease, mad cow disease, things like that. But animals get a lot of diseases just like we do. I know I'm asked all the time, like, well, can a dog get a cold? Or, how often do you see your cat just kind of being lethargic, and is it sick or is it not sick? How do they get sick if it's not exposed to other cats? So
Toxoplasmosis.
Don't even get me started on toxoplasmosis. What was that? That was like episode 24, I think. Go back to that.
It's in the earlier vault. But yes, diseases in wildlife, they can be natural and or human driven, but there seems to be one thing to agree on, and backed by research, is that this is an increasing trend towards appearances of novel and introduced diseases with severe consequences for wildlife populations, which was why I really wanted to focus on that. So to help us learn more about the truth around these whispers and headlines, we have some, as always, fantastic expert guest. Here in Minnesota, we are fortunate to have a wildlife health program within the Minnesota DNR. So we have two guests joining from that. Dr. Michelle Carstensen is the current supervisor of this program. She will answer our questions around species here in Minnesota, such as the hot topics you mentioned, chronic wasting disease, or CWD, and HPAI. There's going to be a lot of acronyms, folks, so buckle up. Maybe we'll have to have a cheat sheet. But she's going to join us to learn more. And it would be easy to stick to land, but we are, again, always challenging ourselves, and we do live in the land of 10,000 lakes, and diseases just don't stick to the land. So Dr. Isaiah Itola, also with the Minnesota DNR, is joining in our second interview to talk diseases in aquatic ecosystems. And then finally, we jump outside of Minnesota and invite a guest all the way from Australia. Dr. Michelle Powers will discuss the importance around science communication when it comes to wildlife diseases. So let's kick it off with our first guest. Michelle, you are a name that I have heard, and actually I have an early memory of when I was in college as an intern for the DNR, and I got stationed at my first deer check station. You were like up at, I think it was at the university, but you were giving everyone an introduction and background on what we would be doing at these check stations. And ever since then, your name has been something I hear frequently. It's really well respected in our line of work for wildlife. So I felt wonderful to finally be like, yes, we have a topic. I can invite Michelle. So welcome. Can you introduce yourself to our listeners?
Thanks for that introduction. And by the way, that now makes me feel old. So thank you for that.
Well, let's also it wasn't like I was in college yesterday, obviously.
Okay. We've established we're both old.
We're both old, yes.
That's a good start.
Yeah.
So as you said, I'm Michelle Carstensen. I'm the current supervisor of our wildlife health program, which was really established kind of when they hired me, I suppose. And my former supervisor, a gentleman named Mike Don Carlos, used to joke that we never had wildlife diseases in Minnesota till they hired me, and I started looking for them. So yeah, it's sort of my fault. But it sort of goes with when you look for things, you might find them. And it's also then important to be prepared to find them and what to do with that information.
So you're the first supervisor and only supervisor of this program.
That is correct.
Okay, so what is your background that kind of led you to this career and profession?
I did my graduate work in Minnesota at the university, mostly with whitetail deer, reproduction, nutritional physiology in northern Minnesota. And I was working alongside the Minnesota Department of Natural Resources staff. So I had already insides, connections and met a lot of the staff. So when they were hiring for a 3-year position to work with deer, but it was helping to establish a chronic wasting disease surveillance program, I kind of jumped at the opportunity to get into a formal position. And, I was a poor graduate student, so a paid job sounded really good.
Yeah.
But I really thought it was going to be just a landing spot, and I would move into something more of a deer scientist or to academia. But once I started working in the wildlife health world, we soon after that, this is in 2004, we found bovine tuberculosis in northern Minnesota in 2005, which launched me into a career path that I hadn't known was my fate. So yeah, I was soon in front of public audiences lecturing about bovine tuberculosis, working across all the state and federal partnerships, tribal partnerships. And it was, sink or swim kind of situation. Yeah. And I guess we swam.
Yeah. And I'm, again, to dig even a little bit further past that, did you always know you wanted to go into wildlife, like going into college, or was that kind of discovered? Because it seems rare to find someone that's like, oh, I started with deer and then I kind of stayed that whole route. Like it seems a little bit more straight than what some other folks share.
My path isn't completely straight. I was a dairy farming kid from Wisconsin, so yeah, go pack, go. And anyway, I was going to be a vet, like many kids that grow on farms and you're used to working with animals. That might be a career path you choose. So I started off as pre-vet when I went to college for undergrad at Cornell.
It almost always comes back to that at some point.
Well, one thing I experienced younger in my life when I was just coming out of my senior year was a summer in Kenya, doing a wildlife management course with the School for Field Studies, which is a program that's still around. And that was super impactful from a small town kid to go to a country like Kenya and see animals up close and personal that you only read about in books. And that experience stuck with me as I progressed through undergrad weed out classes, on the pre-med and the pre-vet kids, and decided I don't know that I want to be bound to dogs and cats and working necessarily in a clinic. And wildlife veterinarians were rare at that time. It was really more zoo vets, and those jobs were limited. So I have my parents, on my shoulders saying, well, you got to get an employable career. There's only 3 jobs in the nation that you're going to get, as a wildlife vet in a zoo. So do something more practical. But I stuck with it. And it did take me a few years to find a grad program. I worked for 4 years for a nonprofit in Minneapolis called the Institute for Local Self-Reliance, doing environmental consulting kind of work, and finally went to grad school for wildlife, and that set the path.
Well, that's refreshing to always bring it back to this vet talk. I don't know why. And it especially seems very common with women. I don't know if I'd hear that story as much from the men when I ask them. So I just always find that it's like you're almost pigeonholed right away when you're kind of like, oh, well, this is what women who like animals do. Yeah. They're going to work at a zoo. You can maybe be a vet, and good luck. And it's not till later that you start learning wildlife. There's all this stuff to do with wildlife.
Absolutely. And I think since that time, At the vet colleges, the paths are much broader now.
Yeah.
So there's a lot more in the exotic animal or One Health world that are offering opportunities for students to start to venture into wildlife. There isn't necessarily wildlife tracks yet, but it's getting closer to that.
Yeah. And so this kind of brings me back to learning more about the health program. You mentioned it. It was kind of just all these serendipitous things happening. So can you explain a little bit about what this wildlife health group is for the DNR and what that looks like across the state?
Sure thing. So we currently have 8 staff on the payroll for Wildlife Health Program, which is one of the larger ones in the states. So there's a few other states that have programs at a larger capacity than Minnesota, but we have really invested in this direction in our state. And our charge is really the monitoring and surveillance and management of wildlife diseases in Minnesota that affect game species primarily. So that's our charge, because those are the species that we directly manage in the wildlife section. And that goes with, information sharing across all the partners, like I talked about, developing surveillance programs for diseases that really can impact wildlife populations. So while we are paying attention to one-off things that could be a trauma-induced injury of a wild animal and dealing with the public's interest in that, we really are trying to focus on population-level impacts. So our efforts focus more on diseases that really can drive populations downward and what that consequence are for our resources in Minnesota.
I think I want to start at something really basic, which is how do wildlife get diseases? Is it a lot like how humans do, where maybe a deer has its own version of a cold and it sneezes on another deer? Is it spreading another way? Is it really species to species? Do animals have an equivalent to like the cold and the flu?
Great question. Wildlife get diseases like us, just like you said. It's exposure to pathogens in their environment. Think about insect-borne diseases from ticks and mosquitoes and midges. That's how we get Lyme's disease and anaplasma in wildlife, and also midge-based ones like hemorrhagic disease. So they're a product in their environment just like people are. We also bring diseases with us as humans that can cross into wildlife, as well as our production animals. That's another main interface, is animals that we ship around the nation as production animals can take diseases with them that then expose naive populations in the wild. So there's lots of ways and lots of routes, and some have more serious, impacts than others. They're very resilient wildlife in being able to withstand infections, exposures to pathogens, parasite loads. That would really gross us out if we want to do a parasite talk sometime. I'm all in. They're so cool.
I always love being grossed out by parasites.
I was going to say, it could be a good Halloween one for
Yeah,
October.
That would be.
We did kind of do zombies. We did zombies, so a little bit
I wanted to
there.
do a vampire episode for a while, and, internal parasites are kind of like vampires.
Mm-hmm.
Yeah.
That's a good way of thinking it. So what are some of the main ones? And I know because there could be a lot here that we're not going to have time for, but what are the major diseases impacting Minnesota species?
Well, we're probably going to spend some time talking about chronic wasting disease, and we'll just get the acronym over with now. It's CWD, and that is one of our main projects that we work on relative to white-tailed deer in Minnesota. Other cervid species that we have in Minnesota, elk and moose, are also susceptible, but fortunately we haven't detected that disease in either of those populations. So that's one that has a lot of effort right now. But I also love moose. If you have met me before, I've probably talked to you about moose. And I've spent years doing moose research. And with our moose populations, parasite loads tend to be a huge driver of their mortality. And it's most commonly a parasite that circulates between white-tailed deer and gastropod hosts that leads to disease in moose and death, primarily brainworm or P. tenuis and liver flukes. So for that population, it's parasite mediated primarily. White-tailed deer and CWD, again, that's animal to animal, like we talked about before. Transmission is lateral, but it also can be environmental, as they can leave behind infectious agents that can be available to other deer over time, and that can exacerbate the outbreak. Those are some of the bigger issues we're dealing with. And we'll probably have a little time for high-path AI or highly pathogenic avian influenza.
It's another hot topic currently right now.
That one is really interesting because it sure has changed a lot in the recent years since this latest strain, which was a Eurasian strain, popped up in 2022. It has pretty much blanketed the U.S. in wild birds and outbreaks in poultry, and has actually now moved into dairy cattle and also humans to some extent. And as we are sampling wildlife that come to us with neurologic deficits that are reported by the public, we're swabbing for high-path AI and finding infection in fox kits, bears, and other species, fur bearer species, that we never would have thought would
Even
be
looking
impacted.
for it.
Once again, if you look,
My understanding is that it's relatively rare for a virus to jump species. And that's why when we get a new novel virus, it's probably jumped to species. It's a lot more pathogenic because we haven't evolved together. We're kind of figuring each other out. Do we think it's rare for a virus to jump species like avian bird flu? Or is it more we just haven't tested for it and it might actually be really common?
well, it's luckily we have a really robust barrier in our brain that helps us resist these kinds of viruses. And that has worked well for humans for many years. But what also can happen in nature is viruses like avian influenza, which are endemic in waterfowl forever, the far back as we can go that they've had these viruses, they can change when they get mixed with poultry who are completely novel to these viruses. And that's actually how high-path AI happens, is it goes from a wild bird to poultry and back. It wouldn't be highly pathogenic without that. So when we're mixing with other species that are not adapted to it, it can change. And when it comes back to the birds, the wild birds in that case, it is now somewhat different. And when it goes to us, it becomes somewhat different. When it goes into the wildlife, it can change. So it's that mutation and adaptability of these viruses that can change our susceptibility to it, which is why there's so much heightened awareness with avian influenza, because we've had a fatality in a human now in Louisiana. Mind you that the individual had very close contact with infected poultry in their backyard flock and other comorbidity issues at the same time. So again, the human risk is considered extremely low. And we've had thousands of people exposed to avian influenza, especially poultry workers that are, working on depopulation of infected farms and have very little disease, mild cold-like symptoms. So I don't want to create a panic here. But the reality is over time that may change further. And our ability to be prepared for that, plan for how to test for that, is really important as we think about diseases that at that interface of humans, wildlife, and domestic animals, can really jump into many other directions.
We're recording this in early 2025. So if
Yeah,
somebody's
where this
listening
is
like
big on the news.
2028, this probably isn't like, oh no, there's a new avian bird flu coming out. Just so I want people to know when we're talking about these things. I also want to maybe ask one more thing before we move on from this. And it seems like what you're saying then is that this jumping of viruses from species, it's almost driven by population. We have dense populations of livestock really that maybe wouldn't have existed. And so then you get this disease transmission, the ability for it to change and adapt that maybe we haven't had historically. Would that be accurate, or am I reading too much into that?
I think you're on the right track. It's dense populations. When you think of production animals, they're raised in dense populations intentionally, and they're also, lack a lot of the natural immunity because we've designed them
Grow
for
fast.
our purposes of fast production, high egg output for layers, large breast muscles for birds that are going to be going for food. And by doing that, we also can make them more susceptible to pathogens that in a wild population wouldn't cause any issue. I would also add that it's this interface between this domestic production animals and wildlife that the risk is. And where we can improve is likely our ability to create better biosecurity to prevent those introductions. And that's a challenge because when you plop a farm in the middle of nature, nature surrounds you. It's really hard to mitigate, dust particles and an interaction of wild animals and rodents on farms because you're living where they're living. And setting up really robust biosecurity can be a super expensive opportunity for farmers, and it can be inconsistent among operations.
You have to understand it too. Like, I think even with CWD, this is really true with like deer farms and where you have like they're the same species, but they're different and they're raised differently. And that's where like fences and other like measures you're talking about are really important, but understanding that there's a lot of nuances in there of how high of a fence or what kind of fence or what kind of facilities you would need to keep these populations separated.
Yeah, direct contact in that example is something we could try to mitigate by a permanent barrier, to keep animals from touching nose to nose. But we also think about the landscape that farms are using to grow food for their livestock. They're baling hay, and they're chopping corn, and there can be infectious material in those landscapes that now are brought into the farm and fed to animals. That, again, that have nothing to do with that nose-to-nose contact, but now there's indirect exposure. So it's hard to think about, shoring up all angles when you want to have good biosecurity and being 100% protective.
So then it might come down to, like you said, surveillance and checking and having what does that look like? So when you're talking of all these different species and points of transmission, how do you begin to monitor for some of these things?
That's a good question. Setting up surveillance programs, one, you really have to identify what's your question that you're trying to ask. And you want to have enough samples to have an informed information coming back, right? So you want to have enough confidence that your sample actually can tell you yes or no, the disease may be in this population at some level. So when we set up surveillance programs, we usually are first to define the spatial extent that we want this information, and then establish what's a reasonable sample size that can give us confidence we would find it if it was there. Then the challenge is how to get it. Mm-hmm. So, we have used, when it comes to chronic wasting disease, a wide variety of approaches to collect samples that change from all voluntary systems to mandatory testing to different windows within hunting seasons, different ways to interact with hunters, including self-service sampling stations where a hunter can bring an animal's head there and leave it in a barrel and we take the samples. We have mail-in kits where a hunter can teach themselves through a video how to take samples on their own and send them in. We have partners like taxidermists that we're paying to collect samples for us and then send them in. So we are using so many different avenues to try to engage the public and try to reach those really important sampling goals so that it's for something. Because if you are establishing a surveillance program and you're only testing a handful of animals, you don't have any information really that can inform a decision. And that's where we don't want to invest our energy. Right. We want to have meaningful sampling frameworks that are informative.
Yeah, so you're not like, oh, it's not here. We didn't get it. So let's move on. Everything's good. We wash our hands of it. And then, oops, missed this part, or this sampling method left all of this out. And that's where it was. And I know this was a great experience for me to do the deer check stations. And I believe it's still going. And it's a wonderful way for students to get experience. And I will still this might sound really weird and morbid, but doing those deer check stations, I was like, this is it. I really enjoyed it. And again, this is painting a weird picture of wow, she's really, really enjoying these dead deer. But it was the interacting with the hunters and just seeing this real life surveillance stuff happening on the behalf of wanting to do what's best for these populations, because CWD is deadly. So we're talking, these are diseases that could really impact our populations.
Absolutely. And there's so many candidates that I've interviewed for wildlife jobs that have come through CWD check stations, whether it's in Minnesota or other states. It's something that really leaves an impression with these students and an opportunity to be in the real world, collecting samples, working alongside wildlife professionals, talking to the public. And it really gives them that initial exposure that either sets them on that course or instantly turns them away and says, not happening. Yeah. Could go either way.
No, I saw both that I did multiple years. I did intern under Lou and Moret. And so I got to see some of the vet students that would show up and they were just like, oh, no. I was like, oh, I don't think this will be a career for you if you can't handle this. And the rest of us, we're just loving it and enjoying it. Anything else that you're currently working on and overseeing with your current research and programs?
Sure. Currently doing a multitude of things. We're participating in a national effort to collect samples for SARS-CoV-2 virus, which is the virus that led to COVID. And we're doing that with partnership with the United States Department of Agriculture that has a national program looking at white-tailed deer as a potential reservoir, circling back to what we were talking about, how viruses can change in different animal systems. So we've been working with that. We, again, have the widespread high-path avian influenza work that we continue. And, my favorite part, again, back to moose, is I've been working with moose body temperature data, looking at how they physiologically respond to high ambient temperatures. And we actually were able to find that moose in summer are heat stressed, and that can result in an impact to their survival. So the short of that is that hot moose died at twice the rate. So I think kind of down in that direction, we're looking more at other behavioral aspects of moose related to temperature, that whether they change their behavior, are less active, they seek different cover types, where we might have a management influence on that by creating some habitat improvement projects to make sure there's enough cover next to forage, and kind of sort of the juxtaposition of that landscape for moose as we're trying to recover a moose population. Also, we've been working in contaminants such as PFAS and neonicotinoids. We've been sampling deer for both, as well as waterfowl for PFAS, and finding some interesting things when it comes to how wildlife species are
We had Charlotte on.
picking up the things that we are putting on the landscape and raising awareness to that, as well as concerns about food consumption of a highly valuable protein source in our state. So we're doing some work in that area. We're just about to start an elk collaring project next month, and that's in northwest Minnesota, where we received some funding.
I'm kind of just wondering, we're talking about a lot of these really large diseases that are moving through wildlife and you're kind of monitoring for them, but is there anything that our listeners can do to help manage wildlife diseases or prevent some viruses that might be going around or other pathogens that wildlife might be exposed to?
We encourage the public to report to the DNR when they do see sick wildlife or find wildlife dead. And that's important for us because we can't be everywhere with eyes and ears everywhere. So having the public report things that concern them with wildlife really gives us good information about a novel pathogen that we weren't aware is here or where to look. So you can report through our DNR information line when sick wildlife is observed, and we would encourage that. We do follow up. My staff do follow up with that, as well as local wildlife staff, and talk with landowners of what they're observing. I would say that in some cases, the situation doesn't warrant a response if it's, for example, like one dead songbird, on a property that might have been a window strike. We are looking for things that are more indicative of a disease process. So multiple animals at the same time in the same general location might be when something is happening that could affect the population at large. So we pay a little bit more attention to congregations of animals that are sick or have a mortality response, particularly with things like rabbits, squirrels, and birds. But individual animals such as a sick deer gets reported all the time, and we do follow up with those cases, testing them for chronic wasting disease and others. So the public can report. The public can also pay attention to where we have bans on recreational feeding. For example, with deer, in all the counties that we have chronic wasting disease, there's bans on recreational feeding. And that sometimes is a challenge for the public that just wants to see deer in their yard, and they have the most noble intentions, but it can really lead to disease transmission. And not only CWD, but there's many other types of diseases that animals can share in close contact when they're artificially concentrated by us through mineral licks and salt licks. Skin-based diseases, mange can be transmitted that way. So when humans sometimes have great intentions of trying to help wildlife get through winters, they're actually potentially causing more harm than good. So, really heeding our advice on not, doing supplemental feeding or recreational feeding of wildlife is important to keep them healthy.
Which would also mean like your bird feeders are either put away or out of reach of deer, because that would be you might not be intentionally trying to feed the deer, but if it's not done correctly, then they're coming to it.
Absolutely. We take a lot of calls with sick birds in spring and early summer. That's a result of not properly cleaning bird feeders. And because of the changing weather conditions, grain gets moldy in there. We see salmonella and E. coli mortality in birds. So we don't need to feed our wild birds in those seasons. They do just fine.
Yeah, I take mine down in the summer, so we just feed in the winter for our own our own enjoyment, and then take them down.
And it's also when bears emerge.
Yeah,
and that is a
true,
definite,
too. And the bears are here, folks. The bears are here.
Yep. And they like bird feeders.
How can our listeners report sickness or in animals that they see? Like, how do they go about doing that?
Well, there is a general tip line for Minnesota DNR. There's also an 800 number that you can contact for basically just the info line. There's also through the website, you can click on a link for the general DNR info email and send an email. And there are folks that are triaging those calls and emails to see what it's about and then sending it out to the appropriate staff so that we can respond to those reports.
I think a lot too about people, it seems like it's a big fad now, and I'm one of them. I have backyard chickens. So I think of that like even here in the metro area where I wouldn't have necessarily thought about the effects of like, oh, I have backyard chickens, whatever, they free range here and there. But this could be an issue again when I'm thinking of like what the livestock versus wild birds and if they're in close proximity could be bad.
Absolutely. We've had a definite resurgence of avian influenza, the highly pathogenic, in the backyard flocks with this version of the virus. In 2015, when this virus was here once before, it was not affecting backyard birds for some reason. But this time it absolutely is. And so if folks have backyard birds and they also have feeders for wild birds to come and encourage them into their property or a pond nearby where waterfowl are going to stop and say, hey, that looks cool. I'm going to go check that out. But their chickens
would also be...
Exactly. Or they have domestic ducks as well, and they're intermixing. I mean, that is exactly how this virus is getting into these backyard flocks and killing them.
I think that's important to have a message of that because I am very, we keep ours, where my bird feeders are and where the chickens are completely separated. Our yard is fenced, so there's no turkeys. So yes, being very mindful that wherever my chickens are, the wild birds wouldn't be in there. So I see that all the time now. So is there anything else that you would specifically advocate for someone looking to enter this career? Because again, we all have different journeys and different what's available. But there's a lot of research to still be done. So what words of wisdom would you have for anyone listening?
Well, if you think wildlife health is for you, for one, I love you. You're great. There's so much to do in this realm where you can work, with wildlife. You can work at the human interface. There's, again, this One Health momentum that has really taken off where folks are working about wildlife diseases, but at so many different levels. So there's a lot of opportunity here. And again, as many of the states are growing and developing health programs, the job opportunities are only increasing. So if you want to get in this field, you likely have some sort of a natural resource degree that you were seeking. I still see most of the candidates applying for jobs that have a master's. So that has, become sort of the new standard. And it doesn't really matter to me what your master's is in, what species, whether it was health related. I don't really care. I really want you to have done well in your master's. I wanted you to have done field work. I wanted you to have led students with you or volunteers in the field and developed some leadership skills, gone to conferences and communicated about your findings, whatever they were. Luckily, it would be even more great if you wrote them up into a professional publication because that is part of the research side, is to actually share our findings to peer-reviewed journals. So having some experience with that is great. But it doesn't really matter what you worked on, from turtles to moose. It doesn't even have to be health. It just has to be demonstrating that you had enough drive to get out there and do that work and see it through. And you're going to be at the top of our application lists with a background like that.
Oh, that's so true. I'm looking through applications right now. So very, very yes. You're always like, oh, they just did one other thing? What? Really? Because there's so many opportunities, whether it's a deer check station. There are so many organizations and ways to get involved. So I think that's such a good recommendation to give. Say yes, go find these things, figure out what you like and don't like. So it's really going to showcase your strengths in the end.
And don't be afraid to volunteer. It's great to get paid, and the check stations do pay.
They pay well. They pay well.
That is a big draw. But there's a lot of volunteer opportunities that give really good experience, and you get to meet people.
Networking.
We are such a small field in wildlife still that it really pays to meet people and leave a good impression because they're going to remember you and it's going to come back and help you in your job search later.
Yeah, word will travel fast on whether you impressed or not. So, Michelle, thank you for stopping by and joining us in the studio. I will always, again, credit my time to those deer check stations as really cementing my future in the wildlife profession. And you really do so much amazing work on so many facets of our wildlife. So thank you. Up next, Dr. Isaiah Tola joins to step off land and into the water to share more around wildlife health and diseases in aquatic ecosystems.